As with probably all holistic therapies, questions can be very difficult to answer. Questions generally come from the logical side of your brain as you're trying to make sense of whatever it is that you're questioning. From left brain inquiring minds want to know type of thinking. There's nothing linear or logical about the body or about healing, but I do get a lot of questions and I try my best to answer them. And the purpose of this video is for me to attempt to answer some of the most common questions that I get. So here we go. First question. What are you going to do to me during the treatment? This is probably the most frustrating question for me to answer for people, and probably also the most frustrating for people to listen to me try to explain. The simplest answer is, I'm not going to do anything. But of course, that answer is always met with a blank stare or another question like, well then, what am I paying you for? So the next most simple way to answer this question is probably to say, I'm going to hold space for your body to begin its own unique healing process. Once that begins, I'm going to simply follow your body's movements or just continue holding that space for as long as your body requires. Then I'll scan your body for visible signs of where more restrictions exist and then repeat the process. I know that this answer sounds vague to any linear or logical thinking person, but it really is quite specific. That's really all there is to it from the therapist's perspective. Now, there's quite a lot more to it from the patient's perspective, but that's an entirely different topic of discussion. Yet, even when I answer the question as specific as I can, linear and logical thinking people are still unsatisfied with my answer. They will be asking again, yes, but what will you be doing? And I'll answer again, nothing. And the simple fact is that you can't possibly understand the answer to this question until you get on the table and begin the work. It simply defies explanation, and there's no better way that I know how to help you understand. What I'm not going to do is this. I'm not going to give you a massage. I am not going to adjust or manipulate your spine or joints. I'm not going to prescribe any drugs or supplements, and I'm not going to stick any needles in you or perform any invasive procedures. Next question. How many treatments will I need in order to get the results I want? Okay, as I explained in one of my previous videos, a few isolated restrictions throughout your body will never cause you any problem. Pain and other symptoms occur when many seemingly unrelated restrictions that may have occurred at different times in your life become intertwined and tangled up with each other. Remember that the fascia is like a single giant three-dimensional spiderweb that surrounds and interpenetrates each and every cell of your body with its tiny fiber-like strands. Restrictions look like knots in the strands, and they layer up on top of each other and around each other until you have something that looks like a tangled up mess of string. Let's imagine for a moment that it was possible to point to just one of the knots in this mess of string and say, that's the problem right there. How many other knots do you have to untie before you can even get to the one you've pointed out? That's the kind of question that you've asked me when you asked this question. It's absolutely impossible to answer before I actually get my hands on you and start untying the knots in your fascial web. We'll know that we've released the right one when your symptoms go away, right? I simply don't know how long that will take or how many appointments will be required. I can tell you this, that each and every restriction that we release together will make a noticeable difference in how you feel, and each release is permanent. Your restrictions never come back. It's possible for you to re-injure yourself and create new restrictions, but the old ones will never come back to haunt you ever again. I can also tell you that at least from my own experience, I have never received a treatment that didn't create a noticeable difference in the way I felt. Next question. What should I do or not do before or after each treatment? Finally, a question that's easy to answer. We'll start with the basics. First, plan to wear underwear that's both modest and either loose enough or stretchy enough to allow access to your pelvic muscles. Men can wear boxers or briefs, and women are encouraged to wear briefs and a sports bra or any other type of bra that will provide you with modesty and support while lying in a horizontal position, as long as there are no underwires. If you don't have appropriate underwear, I do keep disposables for you to wear during your treatments, so no worries there. Secondly, as with any other type of therapy, it's imperative to drink a lot of water and get a good night's sleep both before and after your treatments. In addition, it's very important to listen to your body and to honor your body's needs. For example, if after your treatment you suddenly feel a burst of energy and you feel like you could fly home and you have tons of motivation, then you should jump on a bicycle or find some other enjoyable physical activity and burn off that extra energy as quickly as you can. If, on the other hand, you feel completely wiped out or you feel like you've been beaten by a baseball bat, then it's a good idea, if you can, to take a day off work and stay in bed. At least take it easy for a day or two until you get your bearings back. It's important to understand that each treatment will affect you differently, and no two treatments will ever be exactly the same. But your body will tell you what it needs, and it's important that you listen. Another thing that's very important is to make sure you refrain from doing anything about it if pain comes up after your treatment. That means no pain medications, no Epsom salt baths, no liniments, no heat or ice. Don't utilize any of the conventional methods that we generally use to alleviate pain. The reason is because during your treatment, we trigger a healing process that can continue for up to 3 days. If you have pain that comes up during that time, it's what we refer to as a therapeutic pain or a healing crisis. I know that might not make sense to you right now, but you'll understand once you experience it. It's just different than regular pain. So anyway, once you take measures to alleviate that pain, you arrest the healing process. And why would you want to do that? Now, with that being said, if you have to go to work and you're in so much pain that you simply cannot function, then by all means do what you have to do. Just understand that since you'll be arresting the healing process, we'll just have to start it back up again at your next treatment, which isn't the end of the world. You just don't want to sell yourself short if you don't have to. Last question. What all do I get when I sign up for the intensive treatment series? I'll be putting together different packages for different needs. So if you want me to answer specific questions like this, then please schedule a free consultation with me so we can discuss your needs and customize a treatment series that will work for you.